where large amounts of a glucose tracer accumulate in the body. The glucose used in this technique contains a small amount of radioactive material that lights up in the image. If our body doesn't have access to glucose, it will eventually start to produce ketones in the liver from fatty acids and amino acids. Healthy cells can use ketones for energy, but cancer cells may not be able to as easily. Fasting for several days or extended aerobic exercise are both ways that can shift the body towards using ketones for fuel. A ketogenic diet is another. The ketogenic diet attempts to deprive cancer cells of their primary energy source, glucose. The ketogenic cancer evidence. Cancer is increasingly being studied as a metabolic disorder, not just a genetic one. This has renewed interest in the Warburg effect and the ketogenic diet. The vast majority of claims regarding the ketogenic diet and cancer are drawn from lab and animal studies. Findings from animal studies are revealing. A study published in July's Nature found that in mice, the ketogenic diet enhanced the effects of a specific cancer treatment. The drugs in that treatment targeted a signaling network guided by an enzyme, abbreviated P13K, which is commonly mutated in cancers. Consuming foods with carbohydrates increases sugar levels in the blood, which leads to insulin production. Insulin could then activate P13K signaling in tumors. By feeding mice a ketogenic diet, insulin levels were kept low and the drug was more effective, the study concluded. Yet the study also found that the ketogenic diet alone, in some cases, had no effect on the cancer or actually accelerated the growth of leukemia in mice. It may be harmful for patients with cancer when used in isolation, the authors note. Translating animal findings to a study of cancer patients is challenging, given each person's unique diagnosis, treatment needs, and the challenge of following such an extreme diet. The relatively few human trials completed in this field are small, lasting from days to months. Most involve advanced cancers and some deal only with adherence. Current evidence among cancer patients is unclear and articles have reached different conclusions. A 2017 review article found the evidence of ketogenic diets on cancer and treatment side effects missing. AICR-supported randomized controlled study 1 randomized controlled trial examining the effects of a ketogenic diet in cancer patients was recently published in August. The study was AICR-supported and published in the Journal of Nutrition. The AICR-supported study investigated whether the ketogenic diet can shift the metabolic environment to one proposed to be unfavorable for tumor growth among women diagnosed with ovarian and endometrial cancers. In the study, Barbara A. Gower, Ph.D., and her colleagues analyzed data from 45 women diagnosed with ovarian and endometrial cancers. The women were randomly assigned to either a ketogenic or a standard, healthy diet group. The ketogenic group was asked to consume 70% of calories from fat, 25% from protein and 5% from carbohydrates. The comparison diet was one recommended by